This is always a pleasure for me to talk about this subject. When we talk about anything to bring healthcare on a better mode for the patients. See, straight from academic environment in early 70s, I joined government and was part of the Department of Electronics with responsibility of promoting medical electronics in the country. Over the years, I realized that our major strength was in software and ICT, and that is what I realized that how that can be best utilized to really improve the healthcare delivery to the ultimate person, the patient. And suddenly it dawned to us that we can reach the unreached by using one particular mode which was just coming on the horizon, the field of telemedicine. To India in late 90s, from my government, my Department of Electronics, we started promoting this particular field by developing the software platforms, and then chose so many states where we could do the experiment. As a matter of fact, simultaneously we supported so many 2-3 organizations where we could use their software and coupled with video conferencing facilities, computers and facilities to share records and bring in those systems, and suddenly in a number of states these systems started operating. After a few years, Department of Space also started on the same thing. They also set up a few networks. And while discussing with my secretary, then secretary, Rajiv Ratan Shah, I realized, he asked me one question: Mr. Bedi, can your system which you have set up in West Bengal talk to system which you have set up in Kerala? My God, I realized the systems were not compatible. And that was then when the first thought of bringing standardization into e-health came in our mind, and in real earnest we started work on that. It was my good fortune in 2002 when a high level committee was set up under secretary. Then I was given the charge to set up a working group to come out with guidelines. We are only looking at telemedicine, but simultaneously the thought came, why not to look at the total health record, electronic health record exchange? And there were very few organizations in the country who could, especially from the provider side, who could really support us. And interestingly, there was one organization of Apollo Hospitals, Apollo Health Street Limited, who had a lot of interest in this particular area, and we joined hands. So it was in 2003 we came out one major framework for IT infrastructure for health, and I must say, I must give credit to Ms. Sangeeta Reddy, who really gave us enormous support, and very proudly in September 2003 a whole beautiful document covering all aspects of standardization on health information was published on the Ministry of Communication and IT's website. But simultaneously, you see, it was very interesting when we wanted to somehow bring those to operational level. We realized that we were not the appropriate ministry. Appropriate ministry was the health ministry, which could make things mandatory. So we had the first success in 2005 when health ministry itself set up a task force on standards and guidelines for the field of telemedicine. Anyway, a lot of groups were created, and I had the privilege to head one group. But you see, ultimately the major initiative came from Health Ministry in 2010 when a national expert committee was set up to propose standards for electronic medical record in the country. So there were different working groups. I had the privilege of heading the interoperability task team, and it was my proud moment when Health Ministry finally in September 2013 notified those standards for electronic health records. A lot of things have happened since then. See, and actually the major challenge has been, how to make people realize. Simultaneously, there was one particular Clinical Establishment Act which was also notified by Health Ministry, which actually mandated, and that was a law, Clinical Establishment Act, that all health providers should make use of electronic medical record. But then you see, it is obligatory on states, and because health being a state subject, every state is independent to accept or not. Very happy to say so many states have accepted that. And the interesting thing is that those standards were very much appreciated by, and the most encouraging thing was Indian Medical Association. When the first record, those draft report of EHR standards was sent, we got a very, very complimentary comments from this association. So this actually has been the highlight, and now we the major effort from especially from Health Ministry has been to see that these standards are being promoted and are progressively being used. And you see some of the computerization programs like in All India Institute of Medical Sciences, where e-hospital, a software developed by National Informatics Center, is going to be adapted. They are also being encouraged to use the standard, and that software is becoming really trying to become compatible with one very important standard suggested, which is SNOMED CT. And I am very happy to say that a lot of other companies, both in private and especially in public sector, like Center for Development of Advanced Computing in Noida, they have a software called eShushrush that is totally compatible to the standards which have been notified by standard. And obviously, the standards are always a evolving job, and Ministry of Health is very, very active in now it's almost 3 years once the first standards were being notified. That effort to revise the first revision of the standard is also on. The draft was put up for public comments. Very interesting, good public comments came. Those have been incorporated, and I'm very happy that we expect within a month or so the revised EHR standards will also be on the picture. But major issue will always remain on use of these standards, and see, slowly the encouraging response is coming. At least some of the organizations which I have mentioned, in some hospitals they have incorporated these standards. See, ultimately, once the standards are adapted, then you see the major thing, the patient is the ultimate beneficiary. He doesn't have to carry his records anywhere. If he has a record in one particular hospital, the same records can go seamlessly, and the diagnosis of the new, wherever he goes, they will have all his previous history, so that they can make a very, very effective this thing. And also over the years, once we have electronic health records which are which have used these standards, they will be available for data analysis, or what we call typical finding out details which may have long time repercussions of data, digging deeper with the data and analyzing the long term effects. So this is, we are hopeful that ultimately big things will come out once these standards are used by health providers across the country.